Vital signs, temperature. The videos of Swot nurse notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hey guys, I'm Nurse Swot, the owner of the channel, and today we will be looking on vital signs, to be more specific, temperature. Measuring and recording clinical observations and calculating National Early Warning Score 2 can appear in the OSCE exams. You will be expected to correctly record these observations on the National Early Warning Score 2 chart after the completion of vital signs during the assessment station. Now, measurements of the 5 basic functions can be influenced by a number of factors. These can include age, medications, health conditions, and the environment. It is also used to assess one's general health and monitor treatment effectiveness. The 5 basic functions that you are expected to assess during the assessment station of the OSCE exam include 1. Temperature, 2. Blood pressure, 3. Pulse rate, 4. Respiratory rate, 5. Oxygen saturation. Let's look on the first vital sign, temperature. Adults' body temperature are commonly taken either by the mouth, orally, ear canal, tympanic, under the arm, axillary, or the forehead, temporal. I'm sure that persons watching have at least saw 2 of these thermometers and or used them before. There are different types of thermometers. These include forehead thermometer, tympanic thermometer, axillary thermometer, and mercury and glass thermometer. Please note that mercury and glass thermometers, due to safety concerns, have been largely replaced by electronic thermometers. Temperature readings. Now keep in mind that these readings can vary depending on many factors. A few were mentioned earlier in the video. A reading of 38.0 degrees Celsius or 100.4 degrees Fahrenheit and above is considered a fever. 39 degrees Celsius or 102.2 degrees Fahrenheit and above is a severely high fever. Immediate medical attention will be needed, as severely high fever can cause febrile seizures, brain damage, and even death. A temperature reading of 36.0 degrees Celsius or 96.8 degrees Fahrenheit to 37.0 degrees Celsius or 98.6 degrees Fahrenheit is considered the normal range for adult body temperature. And any reading below 35.0 degrees Celsius or 95 degrees Fahrenheit indicates hypothermia. For the OSCE exams, you are required to do the vital signs at the assessment station. Keep in mind that the assessment station is 20 minutes. After completing each vital signs, always state if the readings are within or not within the normal range. Document readings on the National Early Warning Score 2, News 2, chart before the 20 minutes is finished. Based on the News 2 score, please indicate verbally the monitoring frequency hours and if escalation of care will be done. Explain the rationale behind escalating or not escalating care. Remember to write the date, time, your initials, and signature where required. Document correctly on the National Early Warning Score 2 chart, as one simple error will be an automatic fail for the assessment station. Remember, if readings or findings are abnormal, you are expected to escalate care. Read charts carefully to ensure you're writing in the correct section. The frequency of monitoring of vital signs for care plans are based on the National Early Warning Score 2 total score. Recheck as often as possible to ensure you have completed charts correctly. Remember, vital signs are a part of the assessment station. You can decide whether to do it before or during the AT assessment, fulfilling the criteria. Finally, remember to manage your time. Now, how do you document the temperature reading on the News 2 score chart? Well, First, look for the section that states E, temperature, degrees Celsius. The E stands for environment. Please note carefully that only degrees Celsius readings are documented on the News 2 chart. Second, based on the temperature reading, look for the row and column in which the reading belongs. Note carefully that the readings are set within ranges on the News 2 score chart. Please observe carefully each rows. At the end of each row, there may be a score. Score can be from 0 to 3. Now let's use examples. Example 1. Let's say you got a reading of 40 degrees Celsius. Where would you write this finding? As seen on the chart in black. You would write it in the section, row, of greater than or equal to 39.1 degrees Celsius. Why? Because 40 degrees Celsius exceeded the range of what the chart states. You can either write on the chart using numbers, or you can place a dot in the required section to signify where the reading would fall. Example 2, a reading of 37 degrees Celsius. Where would you place this reading? As seen on the chart in red. This reading would fall in the range, row, of 36.1 degrees Celsius to 37.0 degrees Celsius. I hope this was all clear. Further discussions and examples about documenting vital sign readings on the News 2 chart will be done in other videos. This is it for now. Remember to like the video and subscribe to the channel, we have so much more in store.